Yes. Hello, everyone. Welcome to this session. And if you are new to my platform, you've never seen me, this is your first time connecting with me or listening to any of my info sessions. My name is Dr. Jennifer Genty, and I am a functional medicine doctor, and my goal is to help my patients identify the root causes of the digestive issues, weight loss, hormonal imbalance. Because I am a firm believer, until you know what the root causes are, it's going to be very challenging for you to heal your body. I really don't care what anybody says about this, because having done this work for 10 years now, oh my God, I've been practicing functional medicine for 10 years. And I've been in the medical field for almost 20 years, like being a practitioner on the conventional side and now functional medicine, a mixture of both for a long time. So I've done a lot of mistakes, with my patients. I was just one of those doctors that will just spend 5, 10, 15 minutes with the patients, not really knowing what the causes are, right? And to hand you a prescription, a pill. And I've learned that I went to medical school. I went to help people, not to just give them a pill for the ill. And that's exactly what we're going to talk about. So if you have any digestive issues, hormonal imbalance, weight gain issues, I'm your girl. And again, my job is to always identify the root causes, because we don't want to be throwing spaghetti at the wall, right? We don't want to be guessing, let's try this, let's try that. So working with a functional medicine doctor, if that doctor is not focusing on identifying the root causes, it's just going to be like a conventional medicine doctor with a label of functional medicine, okay? But today, I want to talk to you guys about why conventional medicine will not help you. Now, this is not to bash conventional medicine, because I still use some features of conventional medicine in my practice today. For instance, people will come to me with poison IV. I will prescribe prednisone. If you come to me with shingles, I will give you Valtrex. So I still prescribe when it's necessary. I had a patient that was, traveled out of the state, and she ended up with a urinary tract infection. I mean, I can give her herbs, can I? So what did we do? We actually prescribe 1 dose of macrobid. So I still prescribe. So when you watch this video, or you're watching this on my YouTube, or listening to this on my podcast, I don't want you to think that I am completely against conventional medicine. I'm not. Okay. I have love for all of the things that are beneficial in healing our bodies. If we have a tool that's going to help us, yes. My personal opinion, and this is me. I mean, I am an emergency room doc. I was trained in emergency room. Now I am a fully functional medicine practitioner, but still do what I need to do to help my patients feel better when it's necessary. If it means for me to prescribe a medication, guess what? I'm going to prescribe the meds for 1, 2, 3 days max, right? But it's all about the people, the person that's in front of me, what I need to do to help them. So I am not against conventional medicine. And if you believe in conventional medicine, you're watching this, if you get triggered, I'm not going to apologize. I want you to really sit with yourself and find out why. Because we live in a sick, sick world, in a sick country. And I don't know about you, I have yet to find one person in the conventional space that actually is healing the bodies, right? We might be taking the pill and thinking that, oh, my symptoms are going away. Guess what? The minute you stop taking the pill, they will come back. So if you can tell me, Dr. J, I love conventional medicine and that's all I need because I'm taking the medication, I'm doing all of the things my conventional Western medicine doctor is telling me, and I'm healing my body, I'm feeling great, I have no side effects, and I can actually function and thrive in this body I was created and born with, continue. Okay? So I want to talk to you about why conventional medicine cannot help you. Now, when I went to school, um, I had a desire, strong desire to help people. Okay, I'm like, wow, I'm gonna be a famous doctor. People are gonna love me. I'm gonna heal the bodies. They're gonna come to me with all kind of issues, and I'm just gonna just give them a solution. And next thing you know, poof, they are healed. Now I'm gonna go to school. Of course, my journey is different than most. I had to go to many, like I had to face a lot of obstacles to get to where I am. But one thing that I realized, the goal, the desire that I have, the passion that I have for conventional medicine was literally taken away from me. the first time I practiced. Here I am, a young, fresh practitioner in the emergency room. I did some hospitalist job. I also rounded in nursing homes. Didn't like it. I did some primary care. Didn't like it. I'm like, you know what? I'm just gonna stick to emergency room. That's where I was trained. I can just stabilize people's body and then send them to, follow up with the doctors, right? Because I'm like, they come to me sick and they live in stabilized. So I did something, right? I realized all I was doing is prescribing. I was like, wait a minute. What's happening? Why can't I just spend time with these people? No, no, you can't. Why? Because the demand is high. We have a lobby full of people, and these people, we're not really looking to see what's wrong with them. We're just prescribing. So I quickly realized that conventional medicine wasn't for me. Okay. I quickly realized that the medications I was prescribing was actually endangering people. Okay. I quickly realized that the longer you stay on the medication, the longer the increase the risk is for you to get the side effects, to experience the side effects. All right. And one thing that I realized before, when I was practicing, all the side effects were not visible on Google, Dr. Google. Now the FDA is making sure that the pharmaceutical companies are listing all the side effects. Do you ever wonder why you can actually get prescribed medication, go on Google, Google it up, and you see all the things, right? Do you? Even in the commercials, when you have those happy people running across the TV holding hands, I'm happy because I took a biologic, right? Do you ever realize why at the bottom of the screen, or really in like very fast, they just give you all the side effects? This medication can, kill your kidney and infections and endanger your liver, blah, 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 blah. Do you wonder why? Because at the end of the day, medications are used to stabilize. Medications are used to decrease the symptoms. Medications are not used for cure. There's no way you can cure your body. It's not happening with medications. Okay. So there are, just like we have flaws in everything, conventional medicine has a lot of flaws. All right. And I'm going to do another live, maybe, next week, talking about why functional medicine might not be the answer for you. Because I believe, all I want my patients to do is not to I don't want them to put all the eggs in one basket, right? Again, I still believe there's a place for conventional medicine, but what people are doing, what I'm realizing is that everybody's focusing on conventional medicine, completely ignoring everybody's focusing on conventional medicine, completely ignoring functional medicine, where 90% of your interest should be in functional medicine and the 10% in conventional medicine. So why? And then I did this. This info session, this live or this YouTube video, wherever you're watching or listening to this, came about because I am seeing patients come into my practice after seeing a zillion doctors, right? I'm seeing patients come into my practice confused. They're like, I don't understand what I'm doing wrong. I'm actually seeing all the doctors. Literally, Dr. Genty, I'm doing everything the doctors asking me to do. Why am I still tired? Why am I still anxious? Why do I still have gut issues? Why am I not losing the weight already? Why my hair's falling off? My edges, like I'm getting alopecia. Why my skin, the acne is not going away? I'm seeing the dermatologist. My autoimmune is actually getting worse, right? My lupus, my MS, my RA is getting worse. My diabetic numbers are not improved, and I'm taking the medication, right? I'm doing the weight loss situation. Why? And I'm like, okay, I need to talk about this. I really need to talk about this because having been on both sides, right? I did 6 years in conventional and now it's 10 years in functional. Yes, I am knowledgeable. I can be the person sitting here to tell you what would be beneficial for you. So here are the flaws of conventional medicine, and this is why conventional medicine will not help you. It will not help you. If you believe in medications and seeing your doctor for 15 minutes and doing all the testing, carry on. But I also want you to sit with yourself and be like, okay, am I getting better? Is this medication really eliminating my symptoms, or is it just numbing, right? Like we have a headache, we pop some Tylenol or a sumatriptan, Like, is the headache really going away? Did headache really go away? We have, hormonal imbalance. We just went to see our conventional doctor that specializes in bioidentical hormone replacement therapy. And then he gave us some he or she gave us some patches and some cream to put on your vagina. Progesterone, am I really getting better? All right. So the first thing that I would love for you to consider and also talk to you about when it comes to conventional medicine is the visit. There is no way you can spend 15 minutes with your doctor and for your doctor to know what's wrong with you. No way. No way. Now I will fight somebody on this. Well, we are lovers, we're not fighters, but I'm letting you know. When my patients used to come to the clinic I was working at, right? I had some urgent care experience, emergency experience, primary care experience, as I mentioned. I wasn't studying the cases before they come. There's no way. So I'm just waiting. I walked into the room. The person is sitting there. Hi, my name is, Dr. Genty. I heard you have, your blood pressure is elevated. What's going on? Maybe ask a few questions about how high it is. When did you notice it? Like some questions like that. And then in 15 minutes, I'm handing you a pill or a prescription. Back in the days, I used to have samples in my clinic, right? I used to have samples. We used to have those lovely pharmaceutical reps that used to come and visit us, and they used to bring us lunch and breakfast and dinner so that we can promote the pills. I give them samples. I'm like, oh, there's this new medication that just came out that is fantastic. I never discuss the side effects with my patients. I don't have time. I have like 300 people waiting for me. And I'm told that I'm supposed to see 20 patients in 1 hour. I mean, I'm exaggerating, in one day, maybe 13, maybe 10 in one day. So you think I have time to really ask you the proper questions? No, you're going to see the nurse. The nurse going to walk you up, take your blood pressure, maybe listen to your heart and put all this wonderful information on your chart. And then I walked in here, introduced myself, and here we are, 15 minutes, I'm out. I didn't ask you, did you sleep? I didn't ask you anything about again, I might ask a little bit about the onset, but like go into detail about the onset. I didn't ask you if you have any food sensitivities. I didn't ask you what supplements you're taking that could be interacting. I didn't ask you about your stress level. I didn't ask you if you have done other things to mitigate this. Nothing. I don't have time. And to be honest with you, conventional doctors don't care. They already know. We were reprogrammed in our mind to give you the pill. 15 minutes. Hi, how are you? I'm Dr. Jen. Here's the pill. Goodbye. And then you come back, you're like, well, Dr. Jen, see, you give me this pill, it's not working. My blood pressure is still elevated. Oh, I'm still anxious. I'm still moody. I'm still irritable. My PMS is killing me. My symptoms are taking over my life. I'm still not sleeping, really. My headaches is not going away. You need to go see the neurologist. You need to go see the endocrinologist. You need to go see the GI doctor, gastroenterologist, right? Now we have to do all this testing. We don't have time to spend with you to know who you are. What would be the best fit for you? We don't have time, okay? We don't have time. That is the truth. And then, but why do we consistently go to the conventional medicine doctors? Because it's covered by insurance. But guess what? The insurance is literally telling the doctors how much time to spend with you. Yeah. Like the longer the doctor spend with you, there's a high risk that doctor is not going to be reimbursed. So that's the first floor. It's the short office visit. I don't know about you, but if I am seeing a doctor, I'm taking the time and energy and I'm driving to somebody's office, I would love to be heard and seen. I would love for someone to take time and actually listen to me because my body is communicating with me. The symptoms are ways of my body telling me that something is wrong, right? If I'm coming to you and I'm gassed and I'm bloated, right? And I've had those gas and bloating issues for weeks. It's not just last night. My stomach is hurting. It's like, oh my God, I can't fit into my pants, right? I look like I'm pregnant all of the time. My brain fog is taking over my life. I can't function because I'm forgetful and foggy all of the time. I can't sleep because I can't sleep. I have these headaches. Everything I eat hurts. I'm getting this rash. And I'm just seeing you for 15 minutes. Like, you think I have time to really go over and tell you all of the things, right? So yeah, I'm looking at the Instagram. Some people are commenting. Thank you for your comments. So yes, 15 minutes. Even if you say, well, Dr. Genty is covered by insurance, I have no copay, and I have good insurance, which is going away. There's no such thing as good insurance. Everybody pays for insurance. and it's either you're out of network, in network, and it determines how the doctor treats you. I'm sorry, this is the truth. If you're in network, doctors don't get paid. Doctors don't get paid in network. It's the volume game, okay? For us to keep our doors open in network, conventional medicine, we got to see so many patients. In network, doctors paid a little money in network. So therefore, they're not going to take time to really work up or spend the time before, right? And when you come, it's like, okay, quick fixes. What do we need to give you? What do we need to prescribe? What is the standard of care? Like, and off you go. And if nobody's checking on you to see what's happening, right? Like if the medication's working, not working, if your symptoms are improving, not improving, not good. You get the dosage that everybody does. So the first flaw that I would love, I don't know, I was gonna say love to get fixed, but it's not gonna get fixed. The first thing I want you to consider is the short, brief office visit. How is that gonna impact your healing process? Because that doctor used to be me. Again, I'm not bashing doctors. I'm telling you the truth because I need to tell you the truth because people are getting sick. People are getting sick. They are frustrated. They're seeing tons of doctors, and it's not the doctor's fault. It's not your fault. It's not your fault. Trust me, it's not your fault. But you also have to look at the doctor's view as well, right? We don't have time. We got to see so many people. The demand is high, right? And then we don't have enough. Doctors right now are living medicine. Doctors are burnt out, overwhelmed, unhappy, depressed. Mental illness is huge in the medical field. Okay, we don't talk about it because it's like we doctors are supposed to be like, ooh, we doctors, we know, oh, like we went to school, ooh, prestige. Nonsense. Doctors are not getting paid. Doctors, and we have a hefty, like student loans, right? Doctors are anxious and depressed, unhappy. They are living medicine. And those that live medicine, left medicine are making way more money than the ones that are staying. So imagine if I'm not happy with the job, the profession that I'm in, I'm not getting supported, right? And I'm getting people coming to me with like increase, they need me. I'm not even taking care of myself because I got to see 20 patients in a day. I don't have time for a break. I don't pee. I don't have time to eat lunch. Like it's not happening. Once you clock in, you go, 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 go. Okay? So how am I taking care of myself, right? We're supposed to take care of us first before we take care of the world. If I am not well, there's no way I can actually be present and give you 100%. It's not happening. So please think about it, right? Think about how we doctors are not being well, like we don't have anybody to talk to. I mean, when I was anxious, I was like depressed, driving home crying because I'm like, I'm not making a difference. This lady came to me with an infection, urinary tract infection. I gave her antibiotic. In 2 days, she came back with a yeast infection. I'm like, wait a minute. And she's like, doctor, I don't know about you, but when I came to you, I didn't have a yeast infection. Now I'm itchy down there. Okay, it's very uncomfortable down there. Not only I'm having burning when I pee, frequency, urgency, but now I'm itchy. What the heck? So and I'm like, okay, here's a pill. Here's diflucan. Like you go take this pill to counteract the effect of the other pill, right? Antibiotic. One dose of antibiotic can completely decrease your gut microbiome. Do you understand when you don't have the good normal flora in your gut, how it is important, right? When you don't have that, you are literally exposing your gut terrain for opportunistic infections. That is why all of the people that really want to identify the root causes must do a gut panel, whether you have gut issues or not. It doesn't matter because let me tell you something. When it comes to symptoms, so let me use me as an example. If I were to wake up tomorrow with gas, I'm gassy and I'm bloated, right? Or I have acid reflux. These symptoms have been manifested months before I felt it. So if you feel a symptom, it's not because you just got it the day before. No, 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 no. The inflammation has been there way before. It's because the compounding effect of us not healing, the compounding effects of the toxins, of the gut infections. Now you feel it. Whenever you feel the symptoms, I'm telling you, you didn't just get it the day before, the morning of, the week before. It has been there silently for months. Okay? So when you do a gut panel, Every single human being should do a gut panel, a toxicity bundle, hormonal, depending on your age. You are you are looking, and your doctor's evaluating what's there so you can actually nip it in the bud, start fixing it before you start feeling it. Okay, let's go back to conventional medicine. So conventional medicine, the short visit, you can be helped seeing you. A pill for the ill, right? Like there's a pill for every single ill. I'm telling you, there's a pill. You have a headache, there's a pill. If you have an eye pain, there's a pill. Your skin is rashy, there's a pill. Your toenails falling off, there's a pill. Your stomach is bad on you, there's a pill. You can't lose the weight, there's a pill, there's an injection. Diabetic, there's autoimmune, there are many pills for autoimmune. So again, it's like one thing I always ask my patients to really understand. Why is that we have one condition, one health condition, and we have a zillion pill for one thing? Let's take diabetes, right? Diabetes, type 1, type 2 diabetes. Type 2 diabetes is very common. How many medications we have for one condition? Right there tells you the pill was not going to help you. Not only you have pill for diabetes, you have injections for diabetes, right? Right? Weight gain. How many products we have out there for weight gain? A zillion, right? There's injections now. I mean, Ozempic, semaglutide is just, we are in, like, this is the era, right? Like you can literally walk to your corner store and get you some semaglutide. Yeah. Like everybody's selling it. You don't have to see a doctor anymore. You can just get you an injection to lose the weight, right? So I always ask my patients, what do you think for cholesterol? One condition, a zillion medication. Now the question the person I asked this question to, my patient, she's like, well, because not every medication is for everyone. I'm like, okay, that's a fair answer, right? But how do you know which medication is for you? She's like, well, the doctor would know. I'm like, oh, because when I went to school, we had standard of care. We start with this pill first. Okay. And after this, we increase the dosage. If the dosage is not working, we add and we add and we add and we add and we add. So I start with one medication, and then when I'm done with you, you're on 5. If your blood pressure is severely elevated, maybe instead of me giving you Lasix or hydrochloric thiazide, maybe I'll give you metoprolol. If you have palpitations, plus your blood pressure is elevated, metoprolol, because that decreases the heart rate, right? Maybe I'll give you amlodipine. No. So if you have an autoimmune, you have lupus, maybe I'll give you Plaquenil. I give Plaquenil for every. So again, but if one thing I would love, for me, I would have loved to do when I was a conventional medicine is to identify the root causes. If I'm going to prescribe the medications, I should identify the root causes to see what I'm working with, have a clear picture of what's creating the disease, dysfunction, before I give you the pill, right? Because when I ask this question, patients will come to me like, well, Dr. J, not everybody's going to respond and react to the same pill. I'm like, okay, but we have standard of care. Like us doctors literally have a book that tells us what to give you, prescribe you. And if it's not covered by insurance, then guess what? We got to prescribe you the cheapest one, the one that is, like, it's like you have organic medications and then you have non-organic medications, right? The organic is superior. So if your insurance doesn't cover the superior meds, then I'm going to give you the one that's not superior, that is cheap, because that's what the insurance is going to cover. Did you guys see? So a pill for the ill. And another, that should have been my first one, is not identifying the root causes. Like, I don't know what's wrong with you. Disease is a cellular process, right? If you come to me and you have, increased thirst, increased food, like eating, right? And you look a little on the overweight side, maybe I'll say you have metabolic syndrome. Oh, you might have diabetes. Let me do glucose. Let me do hemoglobin A1C. That's it, right? Because most doctors are not checking insulin for diabetes. Most doctors are not. They're like, oh, your hemoglobin A1C is 6.8. You have diabetes. Or your glucose is 100. Your fasting glucose, the one that is a reflection of the 24-hour food you ate, is 100. What is your insulin? So if your insulin is 20, which is completely diabetic, if your insulin is 10, right? If I don't look at the level of the insulin, how do I know how to dose you appropriately? I just give you metformin. The starting dose is 500. So 500 once a day. It doesn't work, 500 twice a day. It doesn't work, let's get you a flex pen. That doesn't work, let's do, like so many medications, right? But we're not looking at the root causes. So again, people will come to me, they'll be like, well, Dr. Jency, functional medicine is expensive. It is expensive for you to be suffering. If conventional medicine, if us doctor had the time to really work you up properly, instead of doing the basic blood test, which is the next thing I'm going to talk about, and dose you appropriately with the medications while you are working on your finances, because I know it's a lot of money to heal your body. To me, I think health is priceless, but that's me. I don't think there's enough money that will give me, that I cannot spend on myself. I'm worthy of spending the money to get my health. Health is wealth, right? A lot of us are just going every day, we're going, we're pushing, but we're not healthy. And then by the time we get to the functional medicine doctor, you're spending a lot more money. You're tripling the amount of money you could have been spent at the very beginning by seeing a functional medicine doctor. That's another video about the money of functional medicine doctor, right? So the next thing we're going to talk about is the blood test. There are a few factors that you need to consider in conventional medicine when your doctor is prescribing the blood test. Blood test doesn't give you the true picture of what's going on in your body. No. So when you go to your laboratory, they extract that blood out of your vein. Guess what? We're looking at the extracellular. The blood is composed of liquid, aka serum, aka plasma, red blood cells, white blood cells, and platelets. So when you go to your conventional laboratory, not functional medicine, conventional laboratory, like LabCorp here in the state of New Jersey, we have LabCorp. We're not looking at the cells, I'm sorry. We're looking at what's outside of your cells, right? So if I'm doing a complete blood count, CBC, a complete metabolic panel, which is CMP, right? Like fancy name, and I'm doing a lipid for your cholesterol, or I'm doing thyroid, I'm doing TSH, maybe T4, because most doctors don't do thyroid antibodies. And that's all I'm doing. Of course, it's gonna come back 90% of the time normal. Yeah. And I'm gonna tell you, you're crazy. You need a Xanax. You need to see the shrink because there's nothing wrong with you because the blood test is normal. And you're gonna look at me like, what? What are you? No, I'm suffering here. And I'm looking at you like, "Ah, okay, well, let me refer you to somebody else. Go do all the testing, right? So we need to do both conventional and functional blood tests. Both. In my clinic, we do both because the goal is to identify the root causes, multiple causes, right? We need to do both. Yes, I am going to check to see your CBC, your red blood cells. There's a few reasons why we check in CBC. I can do a whole video about that if you guys are interested. I am going to check to see your complete metabolic panel. I'm going to see if you have, cholesterol. I'm going to see what your hemoglobin A1C. I'm also going to check your insulin. I'm also going to check your pancreatic enzymes, amylase, lipase. I'm also going to do ANA titer and pattern for autoimmune. I'm also going to do a gut panel, check all the silent dormant pathogens that are just creating inflammation and messing up with your immune system. That's why many of us have always sick all the time. We have the cold all the time, the flu all the time. We don't feel well, right? I'm going to check all these things. So I'm checking complex markers as well as basic markers, okay? But if I don't check all the other things, I'm missing 90% of the pie of what's wrong with you. CBC doesn't tell me why your cells are inflamed. Doesn't tell me, right? High cholesterol doesn't tell me the picture of your heart. I'm checking the C-reactive protein, your cardiac marker. I'm also checking the D-dimer. There's not enough for me to really go with to help you. And we wonder why we get the pill, right? We wonder why doctors are looking at you like you should be normal. So it's the blood test. You should do toxicity bundle. If you are 35 and older, you should do a hormonal panel. And you should also do all the basic and the complex markers in the conventional. Okay? Now, the next thing I want to talk to you, the next flaws about about conventional medicine that we really need to think about is insurance reimbursement. Yes, let's talk about insurance. Now, insurance companies are becoming very smart. Okay, healthcare is a billion-dollar industry. Insurance companies are denying left and right. Medication that used to fully cover, they're not covered anymore. Because insurance companies are realizing doctors are just doing an unnecessary test. Yes, I said it, unnecessary test. I have a patient that I'm seeing, I'm working on her case now. She has gut issues, colitis. She's done 5 colonoscopy and 2 endoscopy. Now that's excessive, right? So the insurance is looking at like, why are we doing all this? Why are we doing all these tests? These tests are costly. So of course the insurance is gonna, like reimburse less. And then all the insurance things are going up, the fees are going up. I know because we do submit on our patient's behalf, and I know, I see it here. So the insurance is like, if the patient came to you with one complaint, you do one colonoscopy, the colonoscopy showed small inflammation. Why are we doing 300 colonoscopies? Like, why do we need 5? Right? Have this person drink this terrible prep. So you do one endoscopy, right? The endoscopy is showing, gastritis or erythema, like redness. Maybe they do a biopsy, the H. pylori. But why are we doing another one? What is the solution? What is the solution? So the more testing we do, the less the insurance is going to cover, right? Again, doctors do that because they don't know what's wrong with you. They don't have time to really take a detailed information, right? Like to really ask the proper questions. So if you come to me and you have colitis, I have a whole bunch of questions to ask you, right? Because at the end of the day, you have lived with yourself, in your body for how many years you live in. Like I'm 42. I've lived in my body for 42 years. I know my body more than anybody else, right? So if I don't ask you the appropriate question, I'm only seeing you for a brief period of time, maybe once. I've never met you before. I don't live with you. So I won't know what is happening. So the insurance is like deny, goodbye. We're not paying for this. This is too expensive. These machines are really costly. No, 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 no. So the doctor has to be very, very mindful, attentional when they prescribe those imaging, even the blood tests. I have a cancer patient that I'm working now. All they're doing is CBC. And I'm like, what are the tumor marker cells? What are the tumor markers? What are the CEA, CA 19.9, CA 125? What are those inflammatory markers? SED rate, homocysteine, like where are those things? None. All they're doing on this poor person is CBC. Every month, the person is doing CBC. Come on, it adds up. So the insurance is not paying. Now they deny this person's, the insurance literally is not paying at all. At all. And here he is trying to find, anyway, so the insurance. Another flaw with conventional medicine, which I started talking about, is not, conventional medicine is not solution-driven. Yep, I said it. There's no way it's not result-driven, it's not solution-driven. You will not heal your body with conventional medicine. It is a disease management process. We are managing your disease with the pills, with the surgery, right? With all the quick fixes we are making, we are managing diseases. There's no solution. So if you are in the solution, investigation, like you want solution, you want to actually fix a problem, again, you can do all of the things in conventional medicine, but you must incorporate functional medicine. Because a true functional medicine process is geared at first identifying the root causes. Even if you invest in just to know what the root causes are, right? And then you can take that information to do what, pleases you, but at least you know the root causes. Yeah, okay, well, I have Coxsackie virus, I have Epstein-Barr virus. Oh my God, I have H. pylori. Ooh, I have parvovirus. Oh my God, my C-reactive protein is elevated. I might have a cardiac event at any moment, right? My insulin is tripled. I am in full-blown diabetes. So you have to really look at solution. So when my patients come to me and I'm like, okay, so you do all this testing, what's the solution? They look at me like, huh? I'm like, what's the solution? Why are we doing all this testing with no solution? You should actually be focusing on solution and results. right? Like, what is the solution? What is the result? I understand you went to the expert, they did wonderful work, but what's the solution? A pill? That's not a solution. So whatever you do in conventional and functional medicine, always ask the doctor, how would you fix this issue? What is my solution? What is my result? If we do all this testing and the results came out abnormal, do you have a plan, right? And do you have someone that you have helped with this particular issue? I mean, I can go on and on and on and on and on and on about conventional medicine, but I'm just going to leave it as that, right? So that's some things for you to marinate on. Again, I think there's a place for both. I use conventional medicine. I do whatever's necessary for my patient. If I have to refer them out, I refer them out. But again, I'm looking at this individual that came to me with one goal, to feel better, to optimize the health, to eliminate the symptoms, right? So I'm going to do whatever is necessary to help that person. So if it involves, if it meant for me to prescribe a medication for 2-3 days, I will do that. But the goal is not to be on that medication until they die, right? It's not to have them see all the people in the world, right? It's to really take time, investigate, identify the root causes, create a customized, individualized protocol for that person, go over the protocol with them, show them a picture, a roadmap, explain to them how we do this, right? And actually, sometimes I will just pull up other people's blood work of before and after and show to my patient, of course, HIPAA, they have to give me the consent and just show people's information like that. But I'm going to show them like, here, this is the person that has the same level of whatever, and this is what we did, this is how, so they can see. Because you want to know, your health is the only thing you have on this planet. We all want to make $1 zillion of money. We want to go on vacation. We want to be present for all the people in our lives, but you can't do that if you're sick. You can do that if you're sick. Okay, so I'm going to answer a few things on, because I'm also streaming on Instagram. Sammy says conventional medicine doesn't address the optimal health. Yes, Sammy, conventional medicine doesn't address root causes, doesn't address solution, doesn't address result, doesn't address anything really. I think it's just an entry to medicine, if you were to ask me, but we should not stay there. We should not stay there because I'm telling you, people will come to me, they had like one little tiny minor issues that maybe were, recommended like some healing, and then after being prescribed all these medications, they end up having like a zillion other issues. Yeah, a zillion other issues. It's like, I didn't have kidney issues, now I have kidney issues. How did you get kidney issues? I don't know. Right? So you really have to pay attention to that. SMRUTIP87 says conventional medicine doesn't, okay, I said that. Cost, it definitely affects access to functional medicine. Yeah, I think it's people's perspective. If you were to ask me, I think functional medicine is the cheapest medicine because again, you are addressing the root causes, right? You're addressing the underlying condition. You're actually getting results. That's priceless. But first, you have to work with a doctor that can help you. Don't just go to any doctor and send your money, right? You have to really fill them out. Go on the website, watch the videos, like doctors that can help you. Go into Google, like, reviews are a thing, right? So, but again, the first initial work you do with your doctor is to identify the root causes. Identify the root causes. If you have to pay $400, fine, identify the root causes. $100, identify the root causes. That's the first initial. And then you take it from there after that. All right. So this is it. This is the end of the video. Thank you so much. I have patients waiting for me. I gotta go. Thank you so much for watching this. Again, we're gonna have this in our YouTube channel. We're also gonna have this on the podcast, the Prepare a Patient podcast. Put your comments below, right? Like, how do you feel? Do you agree? I mean, if conventional medicine is working for you, go for it. If you are always curious about functional medicine, you should investigate. That's a big yes in my world. I think you should have both, okay? But limitations on the conventional medicine, more on the, like, it should be in the functional medicine. You have to find a doctor that is a true functional medicine, because now doctors are, labeling themselves as functional medicine, but they're not really going through the process of functional medicine. And then the first step to healing your body is to identify the root causes. That's number one. And the second, detox. And then whatever else is coming up on the blood test, that doctor that tested you should create a customized individualized protocol to help you with that. All right. So thank you so much. I will be doing another Facebook Live maybe next week. If you like this and you know someone that can benefit from this, please share. If you're watching me on the YouTube, please subscribe. Thank you very much. And I'll see you in the next video. Bye. Ooh.